Welcome back. Now, health indeed is wealth. And we're going to be starting on our health segment this morning with a very delicate topic, but with the right person to discuss it. Dr. Babajide Lawson is a lead consultant and orthopedic surgeon, and he has a lot of experience with regards bone conditions. Now, today we're going to be talking specifically about bone cancers. We've heard a lot about different types of cancers in the past, probably not had much of a focus on bone cancers before, and it's a great opportunity to speak on it this morning. Welcome back to the studio, Doctor.
Thank you. Good morning.
All right, so for those that have never heard of bone cancers before, can we break down what exactly it is?
Okay, so generally, cancers, so if you start from tumors, that will just mean any growth. And then you move on to the next level, which are cancers. And the problem with cancers is that, one, they can spread to other parts of the body. Okay. And two, the effects can be very, very devastating. It has an effect on lifestyle, affects family, and then the cost of care also is rather prohibitive. Okay. And then, unfortunately, if it is in the advanced stages, there really is no cure, which is very unfortunate.
Very, very unfortunate indeed. So in the end, you possibly have patients who end up living quite a long time with bone cancer. But I guess the treatment and the process depends on the sort of symptoms that they come up with.
Yeah.
So let's go over some of the symptoms people could look out for.
Okay, so since the cancers are limited to, we're talking about bone now.
Yes.
One of the common complaints would be bone pain. Okay. And the bone pain is not just the regular, oh, I went to work, had a very busy day kind of pain. It's usually initially dull and persistent. Doesn't really respond that well to pain medication. Okay. And the other thing that also comes up is that sometimes there is now the development of a growth, such that the limb, so the common thing there is that the bone cancers tend to affect the long bones. And by long bones, we mean bones of the arm, the forearm, the leg, and the thigh and the leg. So when that happens, the tendency is that there may be, notice a swelling. Okay. And the swelling continues to get bigger, it's hard. Okay. And then you need to go to the hospital to get a doctor to take a look at x-rays and other things to be able to pick it up. So
someone eventually gets to the doctor's office. What are the things that the doctor tests for?
Okay, so try to get to, listen to the complaints, bone pain, swelling, an x-ray, which usually is the simplest, most basic investigation. Okay. Unfortunately, again, for the cancers, by the time you are seeing it on x-ray, is not a very good sign. Okay. Which would, because it usually is a bit advanced at that point in time. So, but if the person presents early enough, the doctor sees, there are other modalities like a CT or an MRI, which are 3D and are able to pick these things. They're a lot more sensitive, so they can pick it up a lot earlier than when it shows up on X-ray. But the first thing usually would be an X-ray. Okay,
so now the doctors told the patient to get an X-ray, possibly an MRI, and those symptoms actually say it is cancer. So a lot of people...
So let me interject. So, so the first thing is you want to take a look at the bone with the imaging to see is there anything there. And if you do see anything that is suggestive of a cancer, then you move to the next phase in what we call, it's called a bone biopsy. So you just take a specimen of that bone to go and test. One, to prove that, yes, is this truly a cancer? And then you want to type it. What type of cancer is it? Because that will now determine the type of treatment that the patient is offered. It also gives you an idea of the extent of what's going on.
Okay, so when you say type, that's type 1, type 2, or...
okay, so type usually, so that the thing is, okay, so let's dial back. A cancer will arise from a cell.
Okay.
Bone has bone cells, has cartilage cells, has bone marrow and things like that.
Sure.
So it can arise from any one of this. So when you're trying to type it, you want to know, is it from the bone? Is it from the cartilage? Is it from the tissues around there?
Wow.
So that you'll be able to say, okay, this is essentially...
Okay, so I want to dial it back now and talk about things that... I know that there's still a lot of research as to what causes cancers, but I know that it's been linked to lifestyle. So, for instance, is there anything people should be avoiding or not doing to prevent, you know, exposure to this kind of disease?
Okay, so again, unfortunately, there are no obvious recognized causes. And so hence, prevention is literally very difficult to advise about. Like you said, lifestyle is implicated for a lot of cancers, but then you can't really pinpoint and say this particular thing. Although we do know that there are certain congenital or genetic conditions that may predispose the individual to a bone cancer, but as per prevention is literally, we're short of information.
So in terms of statistics now, is it more common in women? Is it more common in men? Is it something that affects children? Okay,
so fortunately, bone cancers are not very common compared to other cancers. Thank God for that.
Okay.
They're commoner in males. We tend to see a lot of them in children, largely because children are still growing and they have rapid growth potential.
Okay.
So, and that's commoner in the second decade, so that's between 11 and 19 years of age. Male over female, then second decade, essentially.
So it is all in all a scary thought for a child, a minor, to go through something like this. And you've probably had to deal with a lot of parents who are at a loss as at what to do. So if there's a couple in your office trying to figure out what to do next, what do you tell them?
All right, so it's a very delicate topic, and you have to be sensitive in how you present the matter, because you cannot make a mistake in the diagnosis, in the sense that you cannot say it's a cancer if it is not, and you cannot miss it if it's a cancer. So the information dissemination is very important. Oh, this looks suggestive of this. We need to investigate further, and we need to be aggressive. Now, once the diagnosis is made, the intervention depends on the timing, and if it's early enough, some of the treatments may include something as drastic as an amputation. With prosthesis, sometimes the children would need to be on chemotherapy, and that's why sometimes you see the heads are shaven and stuff like that. So it's not really a pleasant topic to talk about.
It isn't. But we appreciate you coming to share this information with us, because you just never know who might be able to catch it early enough to deal with it. Thank you so much, Dr. Lawson, for coming to talk to us. We'll see you soon. If you have any questions, make sure you use our social media. Use our hashtag WakeUpNigeria on TVC, and we'll see if we can help with some of your questions. We're heading over to the kitchen at this point. Mary is standing by with our chef.